Most conversations around penile implants focus on the inflatable device, but it is important to understand all available options. In this video, we will take a closer look at the malleable penile prosthesis. We will talk about how it works, who it's for, and why it might be the right choice for certain patients. Hello, my name is Jonathan Clavell, and I'm a urologist and penile implant expert in Houston, Texas. Whether you are a man exploring treatments for erectile dysfunction or a partner trying to guide a patient through their options, this is information you need to know. When a man has erectile dysfunction that is not responsive to medications or other conservative treatments, he can consider getting a penile prosthesis to help him get an erection. However, all men should know that there are different types of implants. There's the malleable implants and the inflatable implants. The malleable penile prosthesis is a semi-rigid device made of bendable rods that are surgically placed inside the corporal bodies of the penis. Believe it or not, according to the implant companies, it is the most common type of implant placed worldwide. Why? Several reasons. Number one, it carries a lower cost than the inflatable device, so it is more affordable for patients. And number two, the malleable implant involves less parts and therefore it is generally easier to place, specifically by surgeons with less experience performing this type of surgery. To understand how the malleable prosthesis works, we first need to remember that the penis contains two corporal bodies that allow a man to give an erection. Unlike the inflatable device that contains three parts that help the device inflate and deflate, the malleable prosthesis is a simpler device that does not require fluid in the system. Therefore, we do not need the pump in the scrotum or the reservoir in the abdomen. With the malleable prosthesis, we place two semi-rigid rods that stay firm enough for intercourse and can be manually positioned to its desired position. This is why we call them semi-rigid. If it was fully rigid, a man would not be able to bend the penis for concealment. By being semi-rigid, when a man wants to have sex with his partner, he can point it straight out, and when he is done with sex and wants to hide it, he can move it down, up to the side, whatever position is more comfortable for him, get dressed, and he carries on with the rest of his day. This type of implant is simpler. There is no reservoir and no pump. There is no fluid in the system like the three-piece inflatable devices. In my opinion, that factor is both its blessing and its curse. Why blessing? Because this implant theoretically should fail less. Unlike the inflatable implants, malleable implants do not require fluid within the system that has the theoretical potential of leaking out. And why its curse? Given that there is no fluid in the system to stretch the implant from the inside, this implant cannot expand beyond its limits to fully stretch the tunica albuginea. Therefore, a man considering a malleable implant needs to understand that the penis will not expand in length or girth with this type of prosthesis. Malleable implants come in different girth sizes. Boston Scientific's Tactra and Coloplast's Genesis rods range from 9 millimeters to 13 millimeters in diameter. And Rigicon's malleable implants range from 9 millimeters and up to 14 millimeters in diameter. Does that mean that a patient can specifically choose which girth they want? Not necessarily. If a man's corporal body and tunica albuginea does not dilate beyond a specific size and diameter, we will not be able to place a malleable rod beyond its limit. For example, while we're doing the surgery, if the surgeon is only able to dilate up to 10 millimeters in each corpora, do not expect that we will be able to place a 13 millimeter malleable rods. The rods will simply not fit. Moreover, if you think that we as surgeons can just try to jam it in, be careful, because if we put in something that is too wide for the shaft of the penis will end up being extremely stiff and rigid, which could lead to discomfort, pain, and problems concealing the penis from others. You might wonder, well, who is an ideal candidate for a malleable prosthesis then? Even though there are many reasons why someone would consider getting a malleable implant, I personally think that there are two groups of patients that could benefit from malleable implants. Number one, men with limited manual dexterity. Malleable implants are ideal for patients who may have difficulty operating the pump of an inflatable prosthesis. Some examples are guys with severe arthritis, men with neurological conditions that limit their grip or their ability to be able to squeeze their hands or squeeze with their hands, and men with previous hand surgery or those with limited hand strength. Does this mean that men with arthritis or limited hand strength cannot get an inflatable penile implant? Absolutely not. I have many men with these conditions who are still able to operate an inflatable pump and are extremely happy they went with the inflatable prosthesis. Remember that if you cannot operate the inflatable prosthesis, sometimes your partner can do it for you. The second group of guys who may benefit from a malleable prosthesis are those with complex pelvic surgery. Remember that unlike inflatable implants, malleable implants don't require placement of a fluid reservoir in the pelvis, which can technically be challenging or unsafe in patients with prior pelvic surgery, specifically in the hands of a surgeon with less experience doing these surgeries. Avoiding the reservoir from an inflatable implant may reduce the risk of injury to adjacent organs like the bladder or the bowel in the pelvis. That said, it is important to remember that in the hands of an experienced surgeon, the risk of injuring a pelvic organ is extremely low. Therefore, in my opinion, this shouldn't be the deciding factor in choosing a malleable over an inflatable as long as you have a surgeon who has a lot of experience. Make sure you discuss this with your surgeon first. What are the 3 benefits of malleable implants? Number 1, it is a simpler device, and with simplicity comes less risk of complications. The malleable implants only involves 2 semi-rigid rods in the penis, no reservoir in the lower abdomen, and no pump. Therefore, it usually is a quicker surgery, which can decrease the risk of infection. Number 2, generally speaking, the malleable implant is more durable, no fluid in the system that can leak out and lead to failure. Therefore, it carries a lower risk of mechanical failure when compared to an inflatable implant. And number 3, the malleable prosthesis carries a lower cost when compared to the inflatable implants. Therefore, it can be more affordable for some patients who need to pay out of pocket for their surgery. Now, what are the disadvantages of a malleable prosthesis? It is always semi-rigid, never 100% hard, and never soft. Some men say that it feels less natural than a natural erection or even an inflatable penile prosthesis. Remember, it will stay in the same semi-rigid state at all times, which can be noticeable through clothing sometimes, or sometimes even awkward for some patients when they are in public. Some men report dissatisfaction with penile length, girth, the rigidity, and sometimes the angle of the erection with these implants. Moreover, even though it is simpler and has a lower risk of infection, it does carry a slight higher risk of other complications like erosion. Why? The malleable rods can cause long-term and constant compression to the tissues of the penis, which can sometimes make them slightly weaker and can lead to migration of those rods and eventually erosion through the skin. And last but not least, many men believe that the malleable implants last forever and carry no mechanical failure. Although rare, malleable implants can also fracture and also fail. In summary, malleable implants are a good option for the right set of patients. The malleable prosthesis is easier to place, it carries less parts, and therefore a lower risk of infection and mechanical failure. However, even though it is simpler, it carries its own set of risks like limited girth and stretch of the penile tissues, higher risk of migration, and also erosion. That said, many men with malleable implants are satisfied because it provides them with a good option and a solution for their erectile dysfunction. You might be thinking, but wait, this one fails less and has less risk of infection, then why go with an inflatable? Because remember that in the hands of an experienced surgeon, an inflatable penile prosthesis can still be safely performed and carries a very low risk of complications. Also, remember that most men are satisfied with the inflatable implant when compared to the malleable implant. What does research say? With the inflatable device, satisfaction rate go as high as 90% and 95%, and with the malleable implant, satisfaction rates are between 70 and 85%. If you believe a malleable prosthesis is right for you, be sure to talk to your surgeon, and I am hopeful that they will be able to guide you to what is best for you according to your needs and specific goals. If you're looking for an expert, we are here for you. See you next time.